Primary care is essentially the basic place where people start and get health care. It is a family doctor, another primary care clinician who cares about the whole person, not just one organ at a time, and who can provide comprehensive care, whether it's preventive care, care for chronic illnesses, acute problems, can get to know a patient over time with a relationship, and then is also someone who can advocate for the patient to get other care that a patient needs, whether it's specialty care, hospital care, physical therapy, home care, and can put it together in a way that meets the needs of the patient as a whole person. Yeah, to rebuild the supply of people working in primary care, family doctors and other primary care physicians, we really need a comprehensive strategy. I mean, one of the simple facts is it's just that medical students are coming out of school incredibly in debt, sometimes $200,000 in educational loans, and they see that they can make 3 times as much as a radiologist or anesthesiologist or dermatologist and as a family doctor. And that's a huge problem. So one of the things we need to do is to close that gap to make it more financially attractive to go into primary care. The other thing, though, is we need to figure out how to make primary care work better. And part of this is it's not just the financial incentives, but people look out there and say, is it a doable job? And what we know now is primary care is actually really hard work. It's an incredibly important part of the healthcare system, but it's hard to make it work well with growing chronic care, growing aging population, and it's more than just one doctor alone can do. So we really need to build teams with nurses and pharmacists and assistants working together with primary care clinicians. We need to support them with electronic medical records and health information technology so that they can communicate more effectively. We need to get the whole system working together. There are several really critical things in the Affordable Care Act that will help advance this reform of primary care that we need so much. So one thing is to change the compensation, to reward great primary care. There's a 10% increase, for example, in Medicare fees for primary care. There is an increase in the National Health Service Corps for loan repayment and scholarships. There's also been some investment in the medical education infrastructure to help really promote training in primary care. It's not enough to just cover people if we don't actually make sure that they have access to care. And the first place people need access to care is primary care.